Well, can you walk us through because this would be a great one in terms of just showing yes, your the pelvic muscles, but when you're talking about the organ prolapse, and we're going to be talking about
Yeah, yeah, no, this is actually a great model because I do it often in my videos. So I have many videos that actually talks about that. But we can do a brief summary. So this is basically the pelvis. So the white part is the bony part. So this is the bony pelvis. And this right here is your external genitalia. I mean, of course, there's no skin, so it's only you see the muscles, but all your pelvic muscles are right here, right? So if you look at it, I hope you can see it clearly. So this is the external genitalia. This little dot right here is the clitoris. This little hole right here is the urethra, which is where urine comes out from. This is the vaginal opening. So that's where babies come out from. Or, when we have menses, our periods, this is where the blood comes out from. And this is, of course, the anal opening, which is where stool comes out from. I mean, this alone, so many women are shocked. They're like, wait, there are all these holes? Yes, there are, right? And what happens is the skin around right here is what we call the labia minora. And that fluffy external genitalia, that's the labia majora, which is right here. I was recently doing a podcast interview with a dermatologist, and we talked about the difference between the vulva and the vagina, because a lot of the times we use these terms interchangeably. So, vulva is what you see on the outside, but the vagina, like I showed you here, is inside, right? So, when we're talking about pelvic floor muscles, I mean, of course, here you see it, but imagine if this is a real patient, this is all skin. So, you're not seeing it. So, when I, as a urogynecologist, is assessing somebody's pelvic floor muscles, what I'm doing is I'm doing an internal exam. So I will put a gloved finger through the vagina and I'm pushing in those muscles, right? Which are these muscles. And I can tell if somebody's pelvic floor muscles, like when I'm pressing over there, like something I tell patients is imagine if I'm pressing on your arms or your thighs, you feel me touching, but it's not painful. If it's painful, that means it's not working correctly.